Hi, so this is a video about Candidemia and invasive candidiasis. I wanted to make this video because I see many people with Candida overgrowth in their gut who are very worried about this, about if they could develop Candidemia or invasive candidiasis. Candidemia basically is a fungal infection of the blood from Candida, and invasive candidiasis is Candida overgrowth everywhere in your body, in your organs, in your blood, and so on. So I wanted to make this video to make these people feel better about it, because very few people will develop Candidemia. So we will talk about this today. I made a detailed video about Candida albicans just a few weeks ago, so I will put this video up there on the top right corner of the screen. So go watch that video if you want to know more about Candida albicans. I also have many videos about Candida, Candida overgrowth, how to heal naturally from Candida on my channel, so go watch my other videos on my channel. I will also put my playlist about Candida up there on the top right corner, so go watch that if you have Candida overgrowth. So what is Candida albicans? As I said, I won't detail that too much here because I made a video with lots of details just 2 weeks ago, so go watch that video. But in a few words, Candida albicans is a polymorphic fungi. It's a yeast, like a rounded shaped monocellular yeast, as you can see here on this picture, and it can transform, it can evolve into a pseudohyphae, like that's what you see here, here, and here, and it can then develop into an hyphae. So a pseudohyphae is like the little yeast that starts to grow filaments, that start to grow kind of arms and legs, and hyphae, it has very long arms and legs, and that's when Candida is pathogenic. That's when it's a pseudohyphae and hyphae. That's when the problem starts. So in this video, I will put some extracts of different studies about Candidemia and systemic candidiasis that I found. So here are the studies. I will put these studies under this video in the description box if you want to go read them. So what are systemic candidiasis and Candidemia? So Candidemia is, as I said, a fungal infection of the blood. It's an infection by Candida. And candidiasis, systemic candidiasis, is you get like a general infection in your body from Candida. Not only it's in your blood, but it goes into your organs. It can be the liver, the heart, the kidney, the brain, the eyes, where you can have in these organs Candida overgrowth. Okay, that's what we call invasive Candidemia. So in 2010, invasive candidiasis, which is the most common fungal infection in France, was the deadliest and was also the fourth leading cause of nosocomial infections in the United States. It affects nearly 3.6 people per 100,000 people per year and nearly 400,000 worldwide. Candidemia is the most common fungal bloodstream infection and the fourth most common bloodstream infection seen in the ICU. It is the most common fungal bloodstream infection in hospitalized patients. Mortality reaches almost 50% in some countries. Okay, so as I said, I want people watching this video to feel better about Candidemia, because what I want to show in this video, it's like very few people will develop this condition. So of course, when we read what we just read, it seems very bad, but here, look at the details. 3.6 people for 100,000 people will get Candidemia. That's not a lot. That's really not a lot. So yes, it can happen. People can have Candidemia, but very few people will get it, and I will go into more details in the next slides. Here, this is a picture to represent the fungal infection of the blood. Of course, I could not find a picture that show Candida, so this is just a virus, but anyway, you get the idea. So which strains of Candida cause Candidemia? Well, it's first of all Candida albicans. This is the main strain that you will find in people having Candidemia. Candida albicans. You can also have Candida parapsilosis, Candida tropicalis, Candida glabrata, and Candida krusei. And the most virulent species are Candida albicans, Candida tropicalis, and Candida glabrata. But really, usually and very often, it's Candida albicans. That's why you certainly have heard of Candida albicans much more than the other species we talked about. It's because it's just the most common. So who is at risk? Are you at risk of developing candidemia or systemic invasive candidiasis? People who may have an increased risk for systemic candidiasis include people who have a weakened immune system. For example, people who have had an organ transplant, have HIV or AIDS, or are on cancer chemotherapy. People who are in intensive care units at the hospital. People who have had surgery, especially gastrointestinal surgery. People who have a central venous catheter. Very low birth weight infants. People who have taken broad-spectrum antibiotics. People who have a very low neutrophil count. So neutrophils are white blood cells. People who have kidney failure. People who have diabetes. People who inject drugs. Okay. And this is in another study, it says that 21.7% of patients who had systemic candidiasis or candidemia were neutropenic. Again, that means that you have a very low counts of neutrophils in your blood. 22.9% had undergone either abdominal or cardiothoracic surgery. 19.7% had received an organ transplant. 52.9% had an underlying malignancy. So, you are at very low risk of developing candidemia, even if you have leaky gut. So, many people who have leaky gut worry because it's true that things that are in your gut, if you have leaky gut, they can get through your gut lining and arrive into your bloodstream. And that's how you will develop food intolerances, allergies, and other problems. I talk about it in many of my videos on my channel. But really, in reality, I have never seen any of my clients, and most of my clients, like almost all of my clients, have leaky gut. They come see me because they have leaky gut. So I have seen many people having leaky gut. I have never seen anyone, and I have seen many people with Candida, of course, with Candida overgrowth in their gut, in their vagina, on the skin. But I have never seen anyone having candidemia or systemic candidiasis. Why? Because again, we just saw here in this slide that people who develop these conditions are people with a very weak immune system, and they are at the hospital. Like most of the people who develop these conditions, they get these conditions at the hospital. It's like a secondary infection. So it's people who are already very sick with something else. Like, as we said, they can have cancer or AIDS or whatever. So they are already very sick. And then they develop candidiasis, like candidemia, after that. So it's really not something that regular people should worry about. This will, like, the majority of the time it will happen to people who are already very sick at the hospital. And they usually get this problem after surgery because of a catheter and stuff like that. Okay, so yeah, I want you to feel better about that because there are very few chances that you develop that. Okay, it's the same for other fungal infections such as Aspergillus niger. I have seen clients who have infection with this type of mold, and it's the same. If you have an infection with Aspergillus niger, don't worry, because it's the same thing as we said with candidemia. It only happens to very sick people. So here are other extracts of these studies I mentioned in the beginning of the video, if you want to pause this video to read the details here. But here I wanted also to say that, like, prior patient exposure to antifungal therapy particularly with fluconazole, appears to be a predictor for bloodstream infection with non-Candida albicans Candida species. Okay, so it meets what we said here. People who have taken broad spectrum antibiotics are more at risk, and it's also people who have been taking antifungal drugs like fluconazole that are at risk. So why? It's because chemical drugs lower your immune system. And as we said, you will develop candidemia and systemic candidiasis when your immune system is very low. So what are the symptoms? How do you know if you have this issue, if you have candidemia? So it's very acute symptoms, mainly fever and chills that do not improve with antibiotics. Why? It's because you can't kill fungal infections with antibiotics, because antibiotics only kill bacterial infections. So candidemia can cause septic shock and therefore may include symptoms such as low blood pressure, fast heart rate, and rapid breathing. Usually candidemia goes with systemic candidiasis, infecting not only the blood but also the organs, as we said. It can affect the central nervous system, brain and spinal cord, abdomen, heart, kidneys, liver, bones, muscles, joints, spleen and or eyes. It can so when it infects the eye, symptoms may include blurred vision with photophobia. And if it attacks your heart, you will have candida endocarditis. It may include fever, shortness of breath, fluid buildup in the arms or legs, tiny red spots on the skin, and weight loss. Okay. So, do you have these symptoms? Again, if you are worried about having candidemia, do you have these symptoms? It's like it is a blood infection. Okay, so you will have symptoms of blood infection. You will feel miserable, like lots of fever, chills, and all the symptoms we just detailed, and it doesn't go away with antibiotics. So again, most people who have candida overgrowth don't have that. How to test for candidemia? You can do different things. Usually you will do blood culture. People you will take some of your blood and they will culture it and see if candida grows. Okay, and there are different ways also to test. So blood culture and beta D glucan are the main tests you can do. So again, if you have candidemia, chances are that you are already at the hospital treated for something else. So don't worry too much about these tests, because again, if you don't feel like you're dying and if you're not already at the hospital, there are very little chances that you have candidemia. If you have candidemia, chances that you are already at the hospital. Doctors are already checking on you, and if they suspect candidemia, of course they will suggest that you do these tests. Okay, so yes, it's interesting to do the test if you suspect candidemia, but again, really, like, most people watching this video are fine and don't have candidemia. And again, if you have candidemia, chances are you are already at the hospital and you are already taken care of by doctors. But let's say you have candidemia, yes, you can do this test. Go check with your doctor and ask your doctor to do this test for you. So what are the treatments if you have candidemia? So the allopathic treatment, like the normal treatment that doctors will give you, normal doctors at the hospital, they will give you antifungal drugs, IV injections of antifungal drugs. That's what they will do. You can also, you can instead take natural treatments, and the most efficient will be essential oils. So I am a naturopath. So of course, chemical drugs are not my first choice. My first choice are natural remedies. And let me explain why in this situation is the same. We have seen before that the main causes of candidemia are chemical drugs. we have seen right before that it's mainly people who are doing chemotherapy, many people who have had lots of antibiotic treatments, and people who have also been treated with chemical antifungal drugs. So is the solution to get rid of candidemia taking even more chemical drugs? In my opinion, no, it's not the solution. In my opinion, natural remedies like essential oils are way more efficient with no side effects or very little side effects compared to chemical treatments. One of the reasons is that bacteria and fungi can develop resistance to chemical drugs, whereas they don't, or much less develop resistance to natural remedies. So that's why natural remedies are more powerful and they are less dangerous for your body. Of course, I'm not saying that essential oils, are exempt of any side effects. Of course, essential oils are very powerful, so you need to know what you do when you use essential oils. Okay, so you can take essential oils to treat candidemia or systemic candidiasis orally or topically on the skin, or you can also use essential oils in suppositories or in inhalation, like breathing, steaming treatments. Okay, so these essential oils are listed in one of the studies I talked about in the beginning of this video. They made different tests to see which essential oils are the most efficient against candida infections, and they found that thyme essential oil, oregano essential oil, peppermint, lavender, rosemary, tea tree, eucalyptus, clove, and cinnamon essential oils are amongst the most powerful to get rid of candida infections. But the two best ones are thyme essential oil and oregano essential oil. Okay, there are two molecules here that are the most efficient for treating fungal infections. It's thymol and carvacrol, okay, that we find mainly in these two, thyme and oregano. Okay, so here I won't detail how much of these essential oils you should take and how exactly and how often and for how long, because this is not something that should be said in a video. It needs to be said in a consultation, when I get to know the person. I need to know the person very well and what's happening with her, to advise for such a treatment. So I won't detail this part here in this video. The key is to reverse the state of immunosuppression. As we said before, you get candidemia when you have a very low immunity, when your immune system is completely destroyed. And as I say in most of my videos on my channel, your immune system is completely destroyed mainly because of chemical poisons. It can be chemical drugs, it can be pesticides, herbicides in your food, it can be additives in your food, it can be heavy metals and so on. So you need to rebuild your body, you need to rebuild a good environment in your body, you need to rebuild a good immune system, and that's what I explain in all of my videos on my channel. So I have a course to heal your gut, I have a course to heal your candida overgrowth. The link is under this video in the description box, so go check that out if you have candida and you need some help. So I hope in this video, I hope after you watch this video that you feel better about candidemia. There are very, very little chances that you develop candidemia. Usually people have candida overgrowth in the gut, in the vagina, and on the skin, and it very, very, very rarely infect the blood or the organs. So don't worry. And again, now, even if it happens to you, if you have candidemia, now you know what to do. Okay, I hope you like this video, and you can ask your questions under this video. I see you in the next video. Bye bye.